doing pretty good. How are you?
Good. My name's Rebecca. I'm going to be the nurse practitioner examining you today. I'm going to wash my hands really quick, and while I'm washing my hands, I'm going to ask you a few questions. Can you tell me your name and your date of birth?
My name is Rusty Shackelford. I was born May 5th, 1986.
Very good. Now, can you tell me who our president is?
Donald Trump.
Good. Can you tell me what year we're in?
It is 2019.
Very good. And can you tell me where we are right now?
We are St. Elizabeth Hospital.
Very good. Now, what brings you in to see me today?
I'm here for my annual physical exam.
Oh, very good. I can absolutely help you with that. First thing I'm going to do is I'm going to get a set of vital signs on you. While I do that, I'm going to get your blood pressure. I'm going to use, which arm? Does it matter?
This arm.
I'll use this arm, and then with your other hand, hold the thermometer in your mouth. Get this blood pressure up on you. Not too snug, right?
No.
Okay. Relax your arm down, and you're just like that. Very good. All right, I got your blood pressure at 118/74, which is fantastic. I'll write that down really quick. All right, and I'm gonna borrow your finger. I'm gonna check your pulse. Sorry. Take that out of your mouth. 98.3, it's within normal limits. Your pulse, I felt, was 74 beats a minute, and you're breathing at about 16 a minute as well. All within normal limits. I'm just going to start by examining your head, so I'm just going to palpate your scalp really quick, okay? You let me know if there's any numbness, tingling, pain, any kind of sensation you get when I'm doing this. Anything?
No.
Good. No pain or tenderness. I'm feeling for nodules. I don't feel any, and I'm also going to inspect the hairline, which is normally distributed for his ethnicity group. I'm going to come in the back, and I'm just going to check behind your ears, look for any suspicious moles that you might miss because it's on the back of your head. Not typically a place you'd get to look for moles. Good. Everything looks within normal limits on that. I'm going to start by looking at your ears next, okay?
Okay.
So first I'm just going to feel around your ears. Any pain or tenderness while I palpate?
No.
Good. I'm going to take a look inside your ears, okay?
Okay.
Alright, I'm going to look inside your ear canal here. It's a little bit of earwax, but nothing excessive. Everything is easily visible. Structures are normal on both ears. No excess serum noted. Very good. I'm going to do something called the Rhine test, and it's going to check your hearing. All right, so I'm going to have you don't have to do anything. I'm going to hit this on my elbow, and I'm going to let you listen to two sounds. You're going to tell me which one is louder. You understand?
Yes.
All right. That's sound one. Sound two.
Sound 2 is louder.
Sound two is louder. Do it on the other side here. This is sound one. Sound two.
Sound 2.
Perfect. That's within normal limits. That's the way it's supposed to be. Next, I'm going to do the whisper test. So I'm going to have you cover one of your ears. Perfect. With your hand, and I'm going to whisper something behind your ear. You're going to tell me what I said.
Okay.
Okay?
77.
Very good. And then do the other one.
Purple orange.
Purple orange. That's exactly what I said. So your hearing's within normal limits, and that shows that your cranial nerve 8 is intact. All right, and then I'm going to move into your eyes. First thing I'm going to have you do is I'm going to test your visual acuity. I'm going to have you hold this at an arm's length, cover one eye with one hand, and then read the smallest line that you can.
LTFPH.
Very good. And then can you do it on the opposite eye as well?
LTFPH.
Good. And then without any eyes covered at all, both eyes, read the smallest one.
LTFPH.
Perfect. That shows, according to the Snellen chart, that your vision is 20/20. You obviously don't need glasses or contacts or anything like that. Cover one eye again for me, and you're going to look straight at my nose, and you're going to tell me how many fingers I'm holding up, okay?
Okay. 2. 3.
Good. And then the other one?
1. 2.
Very good. So your peripheral vision is also intact, and top of the Snellen chart test, that shows that your cranial nerve 2 is intact. Next, I'm going to look at your eyes here. I'm going to check your pupils. So just look at my nose. Good. Pupils are equally round and reactive to light. And I have you follow the tip of my pen light, and I'm going to move through the 6 cardinal fields of vision. Are you ready?
Yes.
Move your eyes only, not your head. Perfect. Keep your eyes on here. Accommodation is intact. All 6 fields of vision are also intact. That all shows, and your pupils are equally round and reactive to light and accommodation. Shows that cranial nerves 3, 4, and 6 are all intact. So very good. All right, I'm going to go on to your nose. I'm just going to start by feeling the bridge of your nose and working my way down. Any pain or tenderness at all?
No.
Good. No nodules or bumps noted. There's no acne on the face. I'm going to look up your nostrils, so if you don't mind just tilting your head back a little bit for me, and I'm just going to take a peek. Good. Mucous membranes are dry and intact. There's no excess mucus production. The next thing I'm going to do is I'm going to test your sense of smell. So I'm going to have you close your eyes, and I'm going to put something underneath your nose. You're going to tell me what you smell, okay?
Okay.
It will be pleasant. It will not be a strong smell. Smell for me.
Vanilla.
Vanilla is correct. I have vanilla flavoring right here. Very good. That shows that cranial nerve 1 is intact. And I'm going to have you clench, find your jaw here and clench your jaw down. Very good. And then push down. Perfect. That shows that cranial nerve 7 is intact. Or 5. Cranial nerve 5 is intact. All right. And then if you could smile for me and frown. Open your eyes real wide and tight. Those tests show that cranial nerve 7 is intact. So now I'm going to move on to your mouth and your throat. I'm going to get this here. I'm going to have you open up and say ah for me.
Ah.
Very good. The uvula moves up as expected, and I'm just going to make you gag a little bit. Good. Gag reflex is intact. That shows that cranial nerve 9 is intact. And checking the buccal mucosa, making sure there's no lesions or open sores. Dentation is good. Gums are pink and moist. And underneath your tongue, no sign of lesions. Very good. Can you stick your tongue out for me? Good. And move it side to side. Very good. That shows the cranial nerve 12 is intact. You're able to move your tongue about. Next thing I'm going to do is I'm going to have you look up just a little bit and take a swallow. Good. So your swallowing ability is intact. That shows that cranial nerve 10 is also intact. I'm just gonna feel your carotid here. Very good. Easily palpable. Good. All right, and I'm gonna take a listen to your carotid. What I need you to do for me is take a deep breath in, then out, and then hold your breath.
Okay.
Okay, whenever you're ready. Very good. Good, and whenever you're ready. Good. Carotids are easily heard. There's no bruise, they're normal vascular sounds. Can you take your chin and put it to your chest? And then all the way up, and then put your head side to side. Very good. Now can you put your ear down to your shoulder? And then the other one? And then shrug up against my hands. Very good. That shows that cranial nerve 11 is intact and you have full range of motion of your neck. No pain or discomfort when you did that, correct?
Correct.
Good. All right, I'm just going to move on to your cardiac system. I'm going to take a listen to your heart. Breathe normal for me, okay?
Okay.
And while I'm doing this, I'm inspecting the skin, making sure that the hair distribution is normal, the nipples are symmetrical, and there's no lesions or rashes to be concerned about either. I'm going to take a listen with the other side of the stethoscope here. Very good. S1 and S2 is noted, no S3, no S4, no gallop, no murmur noted on exam. All right, and I'm going to take a listen to your lungs. I'm just going to need you to take deeper than normal breaths for me, okay?
Okay.
Every time you feel my stethoscope hit your skin, take a deep breath. Oh, hang on just a second. Got to flip it over. Good. Very good. Listen to your back. Same thing, okay?
Okay.
Nice deep breath. Good. Perfect. No wheezing heard throughout, clear lung sound throughout. I'm going to check your lobes here. Can you hold your arm up for me straight out to the side? Very good. Good breath. Very good. And then this one, same thing. Good. All lungs are cleared to auscultation. I'm going to have you stand up for me really quick if you don't mind. Face the other way, and I'm going to feel for crepitus. So when you feel my hands on your back, I want you to say 99. Okay?
Okay. 99.
Good.
99.
Good.
99.
Good.
99.
Very good. Normal crepitus was found throughout. As I'm watching him breathe, the chest is easy, symmetrical with movement. Breaths are easy and unlabored. No shortness of breath?
No.
Good. All right, go ahead and hop back up for me. I'm gonna test your upper extremities now, your two arms. So if you can hold your arms straight out for me, I'm gonna count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. Keep them out for me just for a second. I'm gonna check your cap refill on your hands here. Good. All 10 fingers have brisk cap refill, less than 3 seconds each, and the nail beds are pink. There's no sign of edema in any of the joints. I'm going to feel your pulses, your radial pulses, and make sure they're equal and even. And they are. Very good. Can you squeeze my 2 fingers for me as hard as you can? Good strength in both hands. Hold your arms up like this and pull against me. Good, and push against me. Very good. Good strength in the upper extremities. All right, so next I'm just going to check your reflexes, okay? There's 3 reflexes in your arms I'm going to check.
Okay.
It shouldn't cause any pain or discomfort whatsoever. If it does, let me know.
Okay.
All right, so I'm going to have you relax your arm out just like that. I'm going to check your biceps reflex. Good, I see the muscle twitching. It's contracting, his fingers are moving inward. That's a positive sign. And then on this one, very good. See his muscles twitching and the tendon is contracting the muscle. For the next one, I'm going to have you hold your arm out like an L shape and support it against my hand. Very good. This is the triceps reflex here. Very good. Looking for that jerk reaction. I'm going to do the same thing on this side. Weight against me, relaxed. Good. That's intact as well. Now I'm going to check your brachioradialis reflex, and that's just the tendon in your arm, your forearm here. So just relax your forearm as much as possible. There it goes. Perfect. See the muscles twitch, the fingers are twitching. It shows that that tendon reflex is intact. Same on this side. Fingers are twitching. You've got good range of motion of your hands and your fingers. I'm going to have you go ahead and lay back for me here. I'm going to check out your abdomen. Now, as I'm looking at his abdomen, I'm checking for hair distribution, any surgical scars or suspicious moles that might be. I'm also going to step back to his feet and note the symmetry of the abdomen. It is symmetrical. So I'm going to first just take a listen to your stomach. I'm going to listen to all 4 quadrants of the bowel, okay?
Okay.
You don't need to breathe normal or anything. Very good. All right, now I'm just going to use some light touch, and I'm just going to try to feel around. I'm going to palpate your abdomen in all 4 quadrants. If you have any pain or tenderness, please let me know.
Okay.
Okay? Any pain or tenderness at all when I push down?
No.
Good. Regular bowel movements every day?
Yes.
Good. So the abdomen is soft to the touch. There's no evidence of tenderness, guarding, or rebound. Very good. While you're laying down, I'm just going to take a look at your lower extremities here. I'm going to note your capillary refill on all 10 toes are brisk, less than 3 seconds each. The nail beds are pink and easily blanchable. Very good. Can you push down against my hands and then up towards your nose? Very good. Gonna feel your pedal pulses to make sure they're equal. And they are. Very good. And I'm gonna test your tibial pulses as well to make sure that they're also good. So as I'm checking the pulses, I'm also looking at the lower extremities, making sure that hair distribution is appropriate for age and gender. It is. I'm also going to look at the back of your leg. I'm looking for any varicosities, moles, or skin tears. Skin is dry and intact. It's warm to the touch. Can you lift your right leg up and hold it up for 5 seconds? 1, 2, 3, 4, 5. Good. And then the left. 1, 2, 3, 4, 5. Very good. Now can you take your left leg and move it outwards of your body? Good. And then the right one as well, as far as you can. I know the wall's in the way. Very good. Can you bring your knees to your chest? Good. Perfect. So that shows normal range of motion in the lower extremities. All right. And now I'm going to have you sit back up here for me. And I'm going to check your patellar and Achilles reflex. Just nice and relaxed. Good. Perfect. Positive reflex on both patellars. We're looking for that knee-jerk reaction. I'm going to hold your foot up, and I'm going to bang on your Achilles in the back, and it's going to make your foot go down, okay? So I'm supporting your foot. Perfect. That's a positive reflex. And then over here on your left. And that's a positive reflex as well. Very good. All right, the next thing I'm going to have you do is I'm going to have you hop off the table here. I'm going to have you take a few steps towards that door. And as you're doing that, I'm going to note your gait and your posture, which is within normal limits. And then come back to me heel to toe. And this is checking your balance and your composure, which is intact. Now can you turn around and face the wall here? There we go. And I'm just going to look at your back. I see that there's an old surgical scar here as I'm noting the skin assessment, which is in the history portion. I'm looking for hair distribution, any irregular moles. There are a few moles on the back, but none of them are irregularly shaped or of different shades of color. All right, so you just stand straight for me, and I'm just going to palpate your spine, okay?
Okay.
Any pain or tenderness?
No.
Good. I'm going to have you lean forward like you're tying your shoe. Good. And I'm noting the curvature of the spine and the alignment. The alignment is within normal limits. Go ahead and sit back up. And then bend backwards for me. And then the concaveness of the spine and the lumbar region is also within normal limits. Now, without moving your hips, can you turn your spine side to side? Just like that. Which shows full range of motion in the spine. He's able to bend, lift up, and go side to side. Very good. All right, I'm going to have you go ahead and have a seat again. Thank you. I'm going to have you close your eyes, and you're going to feel this on you. And every time you feel it, I want you to say now, okay?
Okay.
This is testing your sensation.
Now. 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 Now.
Very good. You can open your eyes again. And I'm going to do something that's called the sharp dull sensation, okay? So you're going to feel sharp, and then you're going to feel dull.
Okay.
Okay? So I want you to close your eyes and tell me which one you feel.
Okay.
Ready?
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Good.
Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Dull. Dull. Dull.
Very good. All right. So that concludes my head to toe physical assessment of this patient. Rusty Shackelford. And that's it. Thank you very much.